Okay, let's just give it some time. A little bit early, but let's just give it some time. Let's see. So let's just make sure that my sound is okay. Let me know if you can hear me. If you can't hear me properly, let me know. Let me know in the comment section. Welcome to my first live stream video, first one of the year as well. So welcome everybody. I just want to make sure that we've got everything. Have I got everything? I'm just trying to switch from one. Okay, let me just close this window. I don't want any interference on this video today. Oh, goodness. Okay. Fantastic. So welcome everyone. Thank you for joining me on this live stream. We're going to be talking about what to expect after the emergency birth control pill. And I'm looking at the side effects of the emergency birth control pills. I'll talk a little bit about what they are. I don't want to go into too much detail. I just want this to be a simple chat about what happens after you've taken the emergency birth control pill, because I get a lot of questions on this topic. It causes a lot of alarm. And I just thought it was good to share some thoughts and hopefully help somebody out there understand better what's going on when they're taking the pill. So that's why I've chosen this topic today. And if it's the first time you're coming across one of my videos, my name is Dr. Sylvia. I'm a general practitioner and a health educator. I'm also the founder of Askawayhealth, which is a health information resource. It is on askawayhealth.org. So make sure you can have a look at the website. There's lots of useful health information material out there. I have been practicing for over 20 years. I also have an interest in sexual and reproductive health, and a lot of my videos cover this area, but I do talk about other things. I talk about, of course, the current topic, trending topic is COVID-19. So I do have a few videos on the channel about COVID-19 and its impacts. Talk about general health issues, things, problems that children experience, family health, all these, a mixture of different things you can find on my channel. So make sure you pop in, whenever you can, and just have a look at some of the things that we're doing. But today, we are talking about the emergency contraceptive pill. So let us see. So just some background, why do you need an emergency contraceptive pill? Sounds pretty obvious. You're trying to prevent pregnancy. And that can happen in so many different scenarios. For example, you've not used a condom or other birth control method after having had vaginal sex. Or you forgot to take your regular birth control pills, or you didn't get your shot in time and had sex, or you used a condom and it broke or slipped off after ejaculation, or your partner didn't pull out in time, if you're one of these people who relies on the pull-out method, or in cases when a person is forced to have unprotected vaginal sex. So there are quite a few reasons why you might need an emergency contraceptive at some point in time or the other. So I think it's important to understand the emergency contraceptive is exactly that, for use in an emergency. It's really not suited for regular use. And we find that some women don't have a regular method of contraception, but they are sexually active. And when they have intercourse and are worried about getting pregnant, run off to get the emergency pill, may not take it at the right time or in the best way for them to get the desired effect, and it doesn't work, or it just messes up the period, and so you don't get a good experience. So it's only meant for occasional use. That's the message I'm trying to get across, that the birth control pill, the emergency birth control pill, is only meant for emergency occasional use. Right, so pregnancy can happen anytime in a woman's cycle, theoretically. So any day of the any time at any point in your cycle, you could get pregnant if you have sex. But of course, we know it's more common around the time of ovulation, which is when the egg is released from the ovary, and in the few days just before and after that event. And then the other days of the month where it's less likely to happen, for example, around your periods. And so some women rely on using those days to calculate when it's safe to have sex or not. One of the things that you should know is that even if you've had sex in your safe period, the sperm could still live for 5 to 7 days in your womb. So it's really important to remember that, particularly if you rely on having sex during your safe period. And if this happens, if you have sex during your safe period and then the sperm remain alive and remain viable for 5 to 7 days in your womb, it means that the sperm can hang around until you've ovulated. And this could lead to pregnancy, even though you genuinely had sex during the safe time. Okay, so that said, let's just pop in again, see how it's going out there. Don't forget, ask questions. I'll try and make my talk 30 minutes, 40 minutes, so we can have some time for questions before I end the stream. So feel free to ask questions if there's anything that you'd particularly want some clarity about. Okay, so let's go on. Now, of course, you don't get pregnant the very minute you've had sex. So there's a small window, there can be a small window of a few hours or a few days where you can prevent the egg from meeting the sperm and pregnancy happening. And this is what contraception, this is what the emergency contraception plays on. It's that window where these emergency contraceptive methods find their effect. After sex, if you're looking for something to stop pregnancy, that is not your usual birth control method, you can either use an oral emergency contraceptive method or you can use the coil. So what we have is one of two options. You're taking tablets or you're using the coil. Now, the coil is a small device that's inserted into the womb. It's actually the most effective emergency contraception that we have at the moment. Now, we're not talking about the coil today, but just to let you know that it is the most effective. I think we'll look at that some other day. And I want to focus today on one of the oral emergency contraceptive pills. So let's have a closer look at them. Around the world, there are 3 different groups for oral emergency contraceptives or birth control pills that we use around the world. Now, the first one, and I think it's the most common, is those that are made from synthetic or man-made progesterone. It's always good to have a look at your box and work out what hormone is within the pill that you're taking. But most of the ones that you have on the market are things like Postinor, Postinor 2, Levanel, Take Action, Plan B, One Step. These are these are common names for man-made emergency birth control pills that contain progesterone. And my talk today is actually based on centers largely around these particular pills. In some parts of the world, your regular birth control could be used as a form of emergency contraception. It's not so popular in quite a few places because of the possible effect on your period and how effective it is in actually getting the job done, but it can be used as a form of emergency contraception. So that's regular birth control combining both estrogen and progesterone. So that's number 2, a second method. And the last oral emergency birth control is the one that contains ulipristal, which prevents natural progesterone from working as it should. And so it also works by delaying the release of the egg. So three types of oral emergency birth control methods. The one that contains the man-made progesterone, examples like Postinor, Levonel, Plan B, Take Action, and so on. Regular birth control methods containing the combination of estrogen and progesterone, and Unipristol, and the brand name for Unipristol is commonly sold as Ella or Ella 1. So again, is the third form of oral emergency birth control. Unipristol is quite effective. I don't think it's as popular at the moment just around the world as the first type, which is the progesterone. So those are the three types of oral emergency birth control methods that we have available. Don't forget that you have the alternative, that's the copper device. That's alternative to the oral methods. So, like I said, always have a look at the front or back of your pack of your pill to know what type you are taking. When you also look at the instructions for how to take the pill. So, how does it work? Before we talk about what you expect when you've taken it, how does it work? These pills, these ones that contain Levonel, these ones that we call Levonel, Plan B, One Step, Take Action, Postinor, My Way, and so on, contain levonorgestrel, that's the hormone. And it works by delaying ovulation, that's the release of your egg, by 5 days, about 5 days. And that is usually until viable sperm from any sexual interaction that you just had have died. So it holds your natural cycle, the natural release of your egg at the time of ovulation. That's how the pill works. There's some research that there may be other ways that it works. For example, making the mucus in the womb, your cervix, a bit thicker, preventing the sperm from swimming easily within the womb and the vagina. We think that the best method of action, the best way it works, is actually by delaying ovulation. Okay. Now, for these particular pills, okay, they are most effective taken as soon as possible after sex. Okay, as soon as possible after sexual activity, unprotected sexual activity. You can take them for up to 5 days, that's 120 hours after sex, but they are most effective if you take them 3 days, 72 hours after sex. So what that means is that if you've had sexual intercourse, unprotected sex at 6 o'clock on Friday evening, and you decide to use the emergency birth control pill like Postinor 2, it's most effective if you take it at 7 o'clock or 8 o'clock, that is a couple of hours just after your unprotected sex, compared if you wait until Saturday evening or Sunday morning or Monday morning. The longer you leave it, the longer the number of hours between when you had sex and when you take the pill, the less effective. Okay, it's most effective if you take it as soon as possible after sex. You've got up to 72 hours, but the earlier you take it, the better. And the other thing that you should know is that it tends not to work as well in women who weigh over about 70 kilograms, over 155 pounds. So if your weight is more than this, you may be better off with a different and alternative pill option. And that could be the coil, like I said, or if you're not keen on the coil, then you could use the other option, Unipristol, which is Ella or Ella 1. So that's another option to consider if you don't find that to be a method that's suitable to yourself. Okay. So we've talked about what's in the hormone, what's in the pill. We've talked about different types of the pill, what's in it. We've talked about how it works and how best it works, how best to take it so it works well for you. So it's really important when you're using the morning after pill that contains levonorgestrel to know that it won't work if your body has already started ovulating. Because sometimes some ladies think, oh, this pill didn't work. I took the pill, I did everything they said, but it didn't work. And it probably didn't work because it couldn't work if you took it after ovulating. So if the egg had already been released, it's not going to cause the egg to die. It's not going to stop the egg. It works by preventing or delaying the release of the egg. The egg is still going to get released, but it's delayed by 5 days. So it's really important to understand that when we're talking about the effect of the pill. So, what's the best? How best can you protect yourself? How best, what's the best thing to do? If you're sexually active and you're not prepared to have a baby, regular birth control, and you need to think about what suits you best. There are different methods. There's a whole host of different methods. If you can speak with your doctor or your healthcare provider about what options suits you best, depending on your kind of activities, what's convenient for you, and your medical background. So it's a few things to consider to select a method that's best for you, but there's so many different methods. It's best to have something that is your regular use. And so the emergency birth control pill is just the fallback method. Now, many women get their emergency birth control pill over the counter, easy to get. And it's generally considered harmless. Generally, we haven't come across a lot of stories that indicate any serious harm to a woman from taking the emergency birth control pill that contains levonorgestrel. But a lot of women do develop some side effects that leave them worried and leave them distressed, uncomfortable for a few weeks or months after taking the pill. And the way the pill affects each woman is different. The way your hormone makeup is different from one person to the next. And so it might be, it's fine for some group of women, but some other women would have might have a really uncomfortable time from taking the pill. Now, what you would expect after taking the pill, if you've taken it properly, if you've taken it, like I've said, as soon as possible after sexual intercourse, it's within a 72-hour window, which is when it works the best, and you've taken it before you've ovulated in that cycle, then you can expect that it will prevent pregnancy from that sexual encounter that you've just had before taking the pill. So that's the first thing, because that's the reason you've taken it. So yeah, you can go ahead and expect that, but the proviso is, of course, that you've taken it in the way that I've just described. Now, of course, you might be interested in lots of different aspects with regards to the pill, different methods, why you have really heavy bleeding on the contraceptive pill. I have videos covering this topic, what to do if you experience really bad bleeding on the pill. So make sure you check these videos out. I think that title is let me just have a quick look. Let me see if I can find the title. I'll tell you in a second. So if you go on to our channel, Askawayhealth.org, I will show you. Let's see what that is called. So if you're looking at common side effects from, okay, let's just see. Let's just open it up here. Let's see. Okay, so there is bleeding after the emergency birth control pill. When I really go into detail, break it down in that video. And then there's abnormal bleeding after birth control. That's after regular birth control pills. Why it happens? Some women experience it, some women don't. So, have a look at those two videos on our channel, on the channel, if you want to learn more about how they could develop. Okay, so looking at the emergency birth control pill, what are the common side effects? So now we've talked about what you can expect, which is the positive effect while you've taken the pill for it to prevent you from getting an unplanned pregnancy when you've taken it properly. Most of the side effects of the pill are temporary, okay? They're harmless, so they don't last, they shouldn't last more than one or two, a couple of days. In some women, they might be a bit longer, they might go into a week, 10 days or 2 weeks, but they're mostly temporary, short-lived, and harmless. They could be annoying because obviously they're inconvenient, but they should not cause severe problems. The earliest possible effect you could have once you've taken the pill, whether it's Lemonel, whether you're taking Postinor and you're taking just the one tablet, or you're taking one tablet and another tablet followed 12 hours later, the earliest common effects that you could have are problems like pain in your tummy, in the pelvis. But this pain is sort of a period kind of pain, cramping. It shouldn't be severe pain. It should be a pain that's tolerable. Okay, so it should not be severe pain. There could be, and this is not every woman will experience this, but of course, some women may. So there might be belly pain and cramping. Some women could experience tenderness in the breasts, and these are effects of the hormones, because, like I said, this is a man-made progesterone hormone, and this is a hormone that naturally the body produces in women, and it does have effect on our reproductive organs, has effect on our breasts, and has effect on our womb. So the synthetic version, one of the side effects is tenderness of the breasts. Another side effect that you might experience is dizziness. So, when I was talking about some effects that might be annoying or might be inconvenient, might make you feel a little bit lightheaded. Now, this should not be something that is severe. It should not last a long period of time. It might be something that just makes you lie down for a couple of hours and then you recover. Some women feel tired. Some women feel really exhausted after taking the pill. Some women get headaches. There is a link between hormones like progesterone and estrogen with headaches, but the quantity, the amount of progesterone that you have in the emergency birth control pill is not very high. And again, it's for occasional use. And I don't expect that anyone will have a severe headache, because if you do develop a severe headache after taking the pill, of course, you must report that to your healthcare provider, visit your doctor. So a bad headache is not expected after taking the emergency birth control pill. You might get niggly, slight or moderate headache that should settle with rest or simple pain medicines like paracetamol, but nothing severe, nothing as bad or as painful as a bad migraine or tension headache and so on. Okay, so we're still talking about the side effects that could happen from taking the emergency birth control pill. Another one is having an upset tummy. We've talked about pain, haven't we? We've talked about pain in the stomach. We've talked about cramping, but you could also have feelings of nausea, so feeling very sick and feeling like vomiting. That is another very common side effect for the pill. So let's have a look. Yep, making progress. Good. So we've talked about what I call the very early effects. As soon as you take the pill, within a couple of hours, this is what might happen. And something else to remember, we've just said some women could experience vomiting. They might feel very sick. If you've taken the pill, if you've taken the emergency birth control pill and you've vomited within a couple of hours of taking the pill, this means that your body is not absorbed it, and you should take another pill. So, yeah, so if you've taken, if you've had your pill tablet and something happens, you throw up, within a couple of hours, please repeat the pill as soon as possible, as soon as you can. It may be the vomit was one-off, let your tummy settle down, give it a couple of hours, but then repeat the pill because it certainly hasn't been absorbed. So it's really important to remember that if you vomit after taking the emergency contraceptive pill or the birth control pill. What else could you expect? There could be changes to your menstrual cycle. So this is the big one. This is the big, one of the biggest issues is how it affects your menstrual pattern, how it affects your bleeding pattern, how it affects your menstrual pattern, your blood flow. What you should expect if you've taken the emergency birth control pill, that is the levonorgestrel, Plan B, Take Action, Postinor, Postinor 2, Levonel, is that your period would come at the usual time for many women. But it might come slightly earlier or it might come a little bit later than your due date. So one of the really important things that you must keep track of is what happens to your period. You know, you really got to be sharp on your dates. And it should be a matter of habit anyway for us ladies to keep track of our dates when we have our period, because it just helps to track everything else that's going on in your body, having an idea of how regular your periods are, keeping a diary or making a note on your phone so that we know if you have a regular cycle. It helps to give advice about if there's something abnormal going on or not. So very good practice to start early on, keeping track and monitoring your periods. Now, so expect your period to come at the usual time. It might be a little bit earlier, a bit later. So we're talking about a couple of days earlier, a couple of days later, okay? If your period is more than 1 week late, you've taken the pill, emergency birth control pill, earlier on in the month, and you're expecting your period to come on the 16th, and it's the 24th, then you should do a pregnancy test. While the emergency birth control pill is very effective, it's certainly more effective than some natural birth control methods, it does still have a failure rate, and that's if it's taken properly. It can still fail even when it's taken properly. But sometimes it isn't. A lot of times it's not even taken properly. Some people might miss a dose or end up taking it later than they should. And for some reason, it's not worked, basically. So it's not worked, and there's a very high chance that you could be pregnant. So it's best that if your period is more than a week late, please do a pregnancy test. If you've taken the emergency contraceptive birth control pill earlier on in the cycle, and if you've had unprotected sexual intercourse before taking the pill. So you could expect changes to your cycle. In many women, your period comes at the usual time, or it could be a bit later, or it could be a little bit earlier. That is what you would normally expect. That you don't need to worry about that. If it comes slightly earlier or slightly later, and then subsequently your cycle should return back to normal. So the effect on changing your cycle should be a temporary one, and you expect that your period in the next month, unless you take another pill, unless you take another emergency birth control pill, or if you're taking another form of contraception that may affect your cycle, it should come back to normal. The other common and weighty problem that could happen is abnormal bleeding. Abnormal bleeding. This can happen anytime after taking the emergency contraceptive pill. So what do I mean by abnormal bleeding? Well, it's any bleeding that is unexpected. So any bleeding that is outside of your period, which occurs when you've taken the emergency pill. Most often, women experience spotting. Remember when I said the side effects tend to be harmless but annoying? One of the effects is spotting. And spotting can happen anytime within the first week after taking the pill. And all this is from the effect, the disruptive effect of the hormone that you've taken. And so it's expected. Heavy bleeding. So flooding, lots of blood flow from the vagina, very large blood clots. A big blood clot tells us that you're losing a lot of blood in a short time. That's why blood clots are relevant. So having a large blood clot is a sign of heavy bleeding. Of course, very heavily soaked menstrual towels or pads tell us that you're bleeding heavily as well. Heavy bleeding is not a usual effect of taking the emergency birth control pill. So if you find that you've had the pill and a day or two later you're having very, very heavy bleeding, it's getting heavier, that's not expected, and you should speak to your healthcare provider, okay? And I know I've said it before, but I want to repeat it. Severe belly pain, tummy ache, really, really bad tummy ache. That is not expected after you've taken the emergency birth control pill. So please, if you do develop any of those symptoms, please get that checked out, okay? What could cause that? I'll just look at that a little bit, even though it's not the focus per se. But why could this happen? Well, it could be a sign of a pregnancy outside the womb or an ectopic pregnancy. You're not going to get an ectopic pregnancy because you've taken the pill. The risk of that happening is very low. But it is possible that you've had sexual intercourse and perhaps not taking the pill at the right time or in the right way, and gone on to fall pregnant, and the pregnancy has developed outside the womb. A couple of the symptoms that may suggest an ectopic pregnancy is severe pain on one side or across the lower parts of your abdomen, heavy bleeding. So it's important that if you do develop pain that stops you in your tracks, agonizing tummy pain, please seek medical advice. So those are the common effects to expect after using the oral emergency birth control pill. And before I round up, I would also want to say a couple more things about the pill. We should know, you shouldn't forget that the way the pill works is to delay your ovulation. So that means in a few days, you are going to ovulate. And one of the common reasons for why you take the pill and still got pregnant is because you've forgotten that you're going to ovulate and you've not protected yourself. Then you have sex around the time when you ovulate, when your postponed ovulation happens. So this is why we recommend, if you use an emergency birth control pill, have something regular in place if you are going to continue having unprotected sexual intercourse, a condom or other regular form of birth control. So don't forget, the pill, the emergency birth control pill, delays ovulation for 5 days. And when that effect wears off, you will ovulate. And so if you decide to have sexual intercourse later on, after you've ovulated, then of course there's still a possibility that you could get pregnant. Another thing to note is that the birth control pill will not prevent pregnancy from sex that you had earlier in the cycle. So you might think, right, okay, so you had sex 3-4 days ago, and then you've had sex yesterday, so you're going to take a birth control pill. Now, if you'd already ovulated or were just about to ovulate, it is possible that you could get pregnant from sexual intercourse from your first unprotected encounter, the first encounter. And so what I'm trying to say is that you take an emergency birth control pill for every instance, every day's in separate days instance of sexual intercourse. So don't think that the pill you're taking today for sex that you had today is going to protect you from sex you had a couple of days ago. That's not going to happen. So it's really important. Either make up your mind, get some advice from your healthcare provider about the best method that works for you. So you're not just relying on taking several doses of emergency birth control pills in a month or in a cycle. One, that's expensive, and two, that can disrupt your cycle. So you could end up having really annoying changes to your menstrual pattern, just sort of bleeding here and there. And it's simply because of taking the emergency birth control pill, because every time you have sex, because you haven't got a regular birth control method. So if you've had unprotected sex more than 3 days in the same cycle, you might have already become pregnant, and taking the pill, the emergency birth control pill, is not going to prevent that. It's not going to abort an already existing pregnancy. Right. So what can we say? Like I said, I just want to make this a very simple chat this afternoon. We know the birth control pill is quite effective, not the most effective. That's the intrauterine device, or the coil that gets fitted in the womb, or the Ella-1 ulipristal, that's the other oral emergency birth contraceptive. But it is effective when used properly, okay? And if you're going to use it, remember, resume your regular birth control method. As soon as you've used the pills, as soon as you finish with the pill, go back to whatever your regular method was, so you don't get caught out with having sex again later on in that cycle, and fall pregnant. So those are a few points I wanted to talk about today. I have a question. I just wanted to address that question because I thought it was quite useful. Somebody asked, let me just bring this up. Because I think it was a really good question. If I can find it, give me a second. I thought it was a really good question, and I think it ties into what we're talking about. Let's see. Okay. Yeah. Okay. So, so I thought this was a really good question. Someone says, is it necessary to take the morning after pill on my first fertile day? I don't ovulate until 5 more days. But when I check my calendar, it says today's fertile day. So the question is it necessary to take the morning after pill on my first fertile day? So this is somebody who obviously is keeping track of her safe periods and knows when she is ovulating, and which days where she should avoid having sexual intercourse. And she's saying, is it necessary to take the morning after pill on her first fertile day, even though she's not due to ovulate for another 5 days? So you might think, like I said at the beginning, it is theoretically possible to get pregnant anytime during the cycle, more likely on some days than the other. But the reason it's important is the reason why you should take the pill And I think I did talk about this at the beginning. But the reason why you should take the pill is because pregnancy is more likely during your fertile days. And even if it's not the day of ovulation, you shouldn't forget that it takes two to tango. So the other partner in the sexual activity is the sperm, and they are likely to remain viable for 5 to 7 days. So if you had sex on your fertile day and thought, well, I've not ovulated yet, it's fine, but you are potentially going to ovulate in 5 days, and you have sperm within your vagina, within your womb, that will remain alive for another 7 days. So you're going to ovulate and have sperm waiting just in time to meet the egg that you release. And this is sperm from 7 days ago. So that's why it's important to, even though you're not around ovulation, or you think, oh, I'm still a few days away from ovulation, it's important to take the emergency pill, the birth control pill, so that it prevents the possibility of pregnancy. And you get questions like that. Nobody says you have to use regular birth control. It's a choice. I think it's important that you decide whether hormone methods suit you or not, decide whether you want to abstain or whether you want to choose a method that you can rely on. So that might be having the coil inserted in the womb, might be having the implant, it might be taking the tablets, but it's a regular method that gives you the peace of mind that you deserve to have. So that's the end of the stream for today. I haven't got any questions, but thank you to everyone that was in the chat. It's been good to know. Oh yeah, thank you. Thank you for joining the chat. Let me know in the comments after the stream. If you watch the replay, that's fine. Let me know if this was helpful. Let me know what topics that you might want me to cover. Again, I'd like it to be like a simple chat, simple one-on-one about a peculiar problem. And I'm going to go into different topics over the next few weeks and months. I'm going to try and keep it on a regular sort of Sunday afternoon time like this, 3:30 in the afternoon. So if you're free, just pop in, jump in, say hi, ask your question, stick around. So hopefully we'll get some more topics coming around in the next few weeks. Like I said earlier, I am looking at things to do with COVID-19, the vaccines, looking at how safe it is to take the vaccines, talking about the differences between the vaccines, just trying to raise awareness about the benefits of the vaccines around this time. So I do have videos on that on the channel as well. So if that's something that you think would be useful, make sure you have a look at the channel. I cover lots of other topic areas. Being a general practitioner, I do get lots of different. One of the things I love about general practice is that you get so many different issues thrown at you. So it's mental health, children's health, family health, sexual health, men's problems, all sorts of different things. So I do have something to say about one thing or the other. And I think it would be great to hear back from you guys if there's anything you want us to talk about. So I will put out in the next few days, a link for the next stream. It will be next Sunday. I'll put out the link. So make sure you've got your subscribe. Make sure you click the subscribe button and like the video. Also put a click the notification bell so that as soon as I put that, you get to know all about it. Okay, guys, thank you so much for spending your Sunday afternoon with me. I will hopefully catch up with you again soon. Have a great Sunday. Have a great new week ahead. Stay safe, everybody. See you soon.